Pain is an important component of patient assessment. Therefore, it is also considered as one of the vital signs. The first step in management of pain is to assess the patient. A practical definition of pain is that of Margot McCaffrey, who believes that pain is whatever experiencing person says it is, existing wherever he says it is. This definition represents the belief that one person cannot judge the perception or meaning of pain experienced by another person. Although pain occurs when tissues are damaged, there is no clear correlation between the amount of tissue damage and the degree or intensity of pain experienced. For example, patients with extensive traumatic injuries may not report the intensity of pain expected, whereas patients with chronic cancer may experience intense pain for which no tissue damage can be found. Pain perception may also be influenced by a patient's culture, belief system, and cognitive factors too. Please read and know about different types of pain from your textbook. And for this assessment piece, there are a variety of pain scales available to assess pain of patients, whether they are able to or unable to communicate. 0 to 10 numeric rating scale is a popular one. If you had to give a number to your pain, 0 being no pain and 10 being the worst pain you have ever had, what number would you give it? And you have to accept that number for your documentation too. Wong-Baker Faces pain rating scale is another example, and your book talks about it. And whenever you're assessing pain, always make sure that you are also asking for what is their pain goal or where they are comfortable, especially if you're going to treat their pain, if you're doing any kind of intervention. And you might also have to tell your patient that 0 might not be possible, depending on what's going on with the patient. Now let's kind of go over Olcayts one more time. You guys got introduced to it in your first module. So nurses collect data from patients about their pain using a symptom analysis and applying the mnemonic Olcayts. I will just kind of go ahead and give you an example of line of questioning if a patient is experiencing abdominal pain, okay? And I still need you to kind of read in detail from your book too. So let's just say the scenario is a nurse finishes the shift assessment and patient suddenly places his or her hand over their abdomen and they have a grimace look upon their face. So you have to kind of do this line of questioning. You want to know, when did the pain start? So you can start with, are you experiencing some pain or discomfort? So for location, you don't want to assume that just because their hand is on the abdomen that they're having abdominal pain. You all want to ask something like, you're holding your abdomen. Is this where you're feeling the pain? Or can you point out the exact location of pain? And does the pain radiate or change its location? You also want to ask, how long does the pain last? Is it constant or intermittent? What does the pain feel like? What makes the pain worse? So you want to know the aggravating factors. What relieves the pain? You want to ask for alleviating factors. You also want to ask any related symptoms to that pain. If they're having any palpitations, shortness of breath, irregular breathing, nausea, or vomiting. Also ask the patient if they have had that kind of pain at home or some other time. If they did, what did they do to treat it? And what helped, what did not help? It could be as simple as taking some medication or position change, or stopping to do some kind of activity that could have aggravated that pain. You also want to know what is the strength of that pain or what is the severity of that pain. Make sure that you're asking one question at a time. This mnemonic, Olcayts, is a really good tool when you're doing pain assessment or asking questions, problem-based history related to pain. But keep in mind, this does not necessarily apply to mental health assessment. Some people just kind of confuse it that if it applies to this, it will apply to that line of questioning too, but it does not. So become very familiar with this Olcayts mnemonic when it comes to pain assessment.